The second problem with having too many sugars and carbohydrates in our diet is eventually you will overwhelm the ability of the gut to remain sterile. And bacteria and yeast move in and start to ferment those foods, and we end up with a fermenting upper gut. Now, that is a problem for many reasons. The first problem is that those microbes ferment to produce toxins, like ethyl alcohol, propyl alcohol, butyl alcohol, hydrogen sulfide, D-lactate, ammoniacal compounds, and these are all toxic. They have to be, and in fact, if you allowed those products in the gut to go straight into the bloodstream, we would be unconscious very quickly. And the liver does an incredible job in dealing with those toxins. But to do that job, A, it requires a lot of energy, and that energy which we'd much rather spend doing something jolly, and B, it's very demanding of raw materials. So we're using up an awful lot of amino acids, sulfate, glutathione, and some sugars in order to detoxify those nasties. And in the business of detoxifying them, creates free radicals. So one of the reasons why you have a nasty hangover after drinking too much alcohol is all the free radicals that are generated as a result of the detoxification of alcohol. So here's a Christmas tip. If you drink too much at Christmas, and I might do, before you go to bed, take 3 or 4 grams of vitamin C, and you will wake up in the morning with a completely clear head and no hangover. So fermenting gut is a big problem. And another problem with the fermenting gut are the microbes themselves get into the bloodstream. So the fermenting gut is a leaky gut. Those microbes can get in the bloodstream. And then they get stuck at distal sites in the body. And if they get stuck in those sites, they will drive inflammation. So those microbes getting stuck in our joints drives arthritis. They get stuck in our muscles, they drive fibromyalgia and polymyalgia rheumatica. If they get stuck in our blood vessels, they can drive inflammation of the blood vessels and temporal arteritis. In the skin, urticaria or eczema. In the gut itself, inflammatory bowel disease. In the bladder, you can get irritable bladder. And some women suffer terribly with interstitial cystitis, which is nearly always allergy to yeast. It can be allergy to anything, but common is yeast. The really fascinating one is that if you've got those microbes in your gut, then there is potential for those microbes to get into the brain. Not my words, words of Nishihara, a Japanese researcher. And in the brain, those microbes can ferment out neurotransmitters like noradrenaline and adrenaline into LSD and amphetamine-like substances. And this may be the basis of psychosis. So anybody with any psychological condition, whether it's anxiety, depression, schizophrenia, manic depression, psychosis, whatever, the starting point to treat them is a carnivore diet. And certainly a ketogenic diet. And in fact, there's some fascinating research being done in Edinburgh as we speak. Dr. Rachel Brown, who's a psychiatrist there, Dr. Ian MacDonald, looking at reversing schizophrenia with a ketogenic diet. And the results are fantastic. But they're not the first to do this. Again, 2 wonderful psychiatrists, Dr. Abram Hoffer and Dr. Carl Pfeiffer. They were not managing but curing schizophrenia with a ketogenic diet, and I'm quite sure the mechanism of that comes from the upper fermenting gut. One easy way to diagnose people with an upper fermenting gut, and this derives from the work of Caroline Pond. Now, she was doing some research where she was asking the question, where do animals dump their fat when they have an excess of calories? So when they're well fed, which doesn't happen very often in the wild, of course, when they're well fed, where do they dump their fat? And she was working at Milton Keynes, cycling into work and picking up roadkill on her bicycle. And when she dissected that roadkill, what she found is that those animals dumped that fat around lymph nodes. Now, that makes good sense because obviously wild animals are going to be injured in the course of chasing a prey or running away from a predator. And it's the lymph nodes and the immune system that are responsible for healing and repair. And the business of healing and repair is hugely demanding of energy. And fat, having a local source of fat, is the ideal fuel for them to work. Now, if you've got an upper fermenting gut, which is leaky, and you're oozing bacteria and yeast into your bloodstream, then the immune system is very busy in the gut to deal with that inflammation. And that inflammation requires energy. And so fat is dumped around the midriff. And so people have a beer belly. They have a waist that's bigger than their chest. They become apple-shaped. And we know that being apple-shaped is a major risk factor for heart disease, for example, because of these fermenting microbes. So that's a very good clue. Anybody whose waist exceeds their chest or their hips almost certainly has an upper fermenting gut. I'm a bit more pear-shaped. So pear-shaped is desirable.
This fat here that's building up around the abdomen, are we talking about visceral fat around the organs?
Correct. And that visceral fat is deposited, I believe. Now, I haven't got a study that I can evidence-base this other than Caroline Pond's seminal work. But I think visceral fat is symptomatic of the upper fermenting gut. And that is driving inflammation. And we can cure that very easily. We have to, first of all, stop feeding those microbes. Now, the interesting thing in microbes is they can't ferment fat. So a high-fat diet, low carb, and normal protein is a great start because that starves little wretches. And then we want to kill them. And we can kill them with vitamin C, 5 grams, and with iodine, Lugol's iodine, 15%, 3 drops. I like those things to be taken separately because vitamin C is a reducing agent, iodine is an oxidizing agent. They knock each other out. So I suggest people take iodine in the morning, vitamin C at night, or the other way around, whichever you prefer. Although some people comment that iodine disrupts their sleep. So I tend to take iodine in the morning. So that's a great start. And the other tool, which I'm finding very helpful, and I've learned much from the work of Dr. G.I. Janelle, is MSM, methyl sulfonyl methane. Now, it's very cheap. I'm always looking for cheap tools that we can all afford and introduce safely into our regimes. But we are all sulfur deficient. Not my words, but the words of Stephanie Seneff, brilliant biochemist that I'm sure you know her. And she maintains, we're all sulfur deficient. But if you take sulfur in the upper gut, which is an aerobic environment, then it kills these microbes. But in the anaerobic lower bowel, the microbiome, which should be teeming with microbes, in that anaerobic environment, it acts as a prebiotic and it feeds those microbes. So it's a double whammy. So MSM is an additionally helpful way to sort out the upper fermenting gut. Once you're ahead of the game, then we don't need to take all those things all the time. But as I say, I'm quite sure primitive man was in and out of upper fermenting gut. When the carbohydrates were abundant, he was fermenting, and when they were not abundant, then he was not. And in fact, we have a very, very good clue that he had an upper fermenting gut, because we have evolved liver enzymes specifically to deal with the products of the upper fermenting gut. The one we all know about is gamma GT. Now, gamma GT is specific for ethyl alcohol. That's the commonest fermenting product, because what are we going to eat in the autumn? We're going to eat fruit. And what is fruit? It's a bag of sugar with a skin around it, which is covered with yeast. That's how we make wine. That's how we make cider. So if you eat those foods in abundance, you are eating the two ingredients that's going to ferment very quickly. And you will produce ethyl alcohol. But gamma GT is very good at detoxifying ethyl alcohol. So if you go to your doctor and you have a high gamma GT, you'll say, oh, you're drinking too much alcohol, are you? But I have seen teetotalers with a high gamma GT. Why? They're fermenting sugars with yeast. And so I like to see the gamma GT, the AST, and the ALT. These are the 3 liver enzymes that deal with the upper fermenting gut. I like to see those all below 20. But of course, reference ranges are often much higher than that, because reference ranges are taken from the so-called normal population. But the normal population should be people eating a carnivore diet. And I can tell you, my carnivores, their gamma GTs, AST, and ALTs are way below 20.
Okay, so upper fermenting gut, you've told us 3 different supplements that can help eradicate that. The ketogenic diet is also part of that protocol.
Correct.
The good news in all of this, whether it be the upper fermenting gut or insulin resistance, is the upstream treatment is the same. Getting rid of the ultra-processed foods, bringing the sugars down, bringing the carbs down, and then again, those 3 supplements if we have an upper fermenting gut to at least temporarily tame that down.
Correct. And then
it gets very complicated and expansive throughout the body, especially with the upper fermenting gut and different symptoms we can have. But again, the good news is treatment is relatively simple.
Correct. Well, it's intellectually simple. It's practically very difficult for people because, of course, sugars and carbohydrates are so addictive. And I'm an addict. I can absolutely sympathize with that. In fact, I have an addiction test for foods. And my addiction test is if I can have one of those foods and not finish the packet, then that's okay to have in the house. But I wouldn't dare have a bag of cashew nuts in the house, because if I had one cashew nut, guess what? The whole bag would disappear. I daren't have a bar of chocolate in the house, because if I had one square of chocolate, the whole bar would disappear. So that's my personal addiction test, which helps guide me as to what's safe to eat and what isn't safe to eat. But the third thing we have to do then is we have to think about insulin resistance. And insulin will come into play, on Christmas Day when I eat all the wrong things, then of course I'm going to spike insulin. And for insulin to work, it's got to have some essential cofactors, things like chromium, carnitine, vitamin B3 and vitamin B1. Those are the important micronutrients for insulin to be effective. And then insulin can be, we can have insulin resistance because the insulin receptor is blocked by something. Now, this is often a toxin. And the best example of this was there was a fire in Italy at Sveso in the 1970s. I think it was about 75, I think, when the factory caught fire and there was a huge release of dioxins. Now, dioxins are extremely nasty, toxic chemicals. And as a result of that, type 2 diabetes just took off in the area immediately surrounding Sveso. So that was the first clue that chemicals cause insulin resistance. And we know the studies have not been done as to tell us which chemicals are critical, but it's going to be heavy metals and it's going to be volatile organic compounds and pesticides. But these days, I don't do the tests to look for the chemical. Why? Because we're all poisoned. I used to do a lot of fat biopsies looking for pesticides and volatile organic compounds. I never saw a normal result. When I do chelation tests to look for heavy metals in urine with the chelation agent, and I use DMSA, I've never seen a normal result. We are all poisoned without exception. So my advice is, the point is, we all need to do the detox regimes. So don't spend lots of money on expensive tests. Just get on and do the detox regimes. And this is a hot subject of a whole other lecture, but briefly, any heating regime will allow us to boil off, as I call it, not sweat out, boil off volatile organic compounds and pesticides that are dumped in our fat. You see, the liver can cope with some of those chemicals, but if they get past the liver, maybe because we've inhaled them or maybe because they've come through our skin, they get stuck in our fat. So the liver enzymes can't get at them. So we have to mobilize them. And this is predicated on some wonderful work by an American surgeon called Bill Ray. And he was working in the 60s and the 70s as a cardiothoracic surgeon. And in those days, the anesthetic gases were not scavenged. So essentially, he was poisoned by anesthetic gases from the operating theatre. And when you get poisoned by a chemical, that's often followed by allergy to that chemical. So he developed multiple chemical sensitivity. He was unable to work. So he got interested in ecological medicine and set up the Dallas Environmental Center in Texas, where he asked, how can we detoxify? How can we get rid of these chemicals? And at that time, he was doing blood tests to measure chemicals to see what was in the blood. And he accumulated 210 patients that he put through detox regimes. And these regimes were heating regimes, massage, and then showering off. And the idea here is we are heating up the chemicals in our subcutaneous fat, boiling them off onto the lipid layer of the surface of the skin, and then washing them off in a shower. And what he demonstrated, well, the first interesting observation he made is that 200 of those patients initially got worse. Why? Because we're mobilizing chemicals from the fat into the bloodstream, and they're getting acute poisoning effectively. But when he continues their regimes, A, these people improve clinically, and B, he demonstrated through testing that they reduce their total toxic load. I've collected about 30 patients that I've done fat biopsies before and after such regimes, and in every single case, the toxic load is reduced. So as I'm saying, don't spend money on expensive tests, just do the regimes. And I don't think it matters what heating regime is used. Sauning is wonderful if you've got the time, but if not, bathing, Epsom salt baths works really well. The key is to wash off the chemicals afterwards. And what would enhance this is to use a detox cream. Now, I've got one. I've made up one which is a mixture of coconut oil, shea butter, vitamin C, and vitamin D. But you don't have to have that. Any oil will do. Any organic oil will do. And so if you put just organic coconut oil on your skin, then that will soak into the skin. It'll soak into the dead cells on the surface of the skin. And guess what? We cast off about 3.5 kilograms of dead cells every year. So as you shed off those dead cells, that nice organic, clean organic olive coconut oil will mop up chemicals that have been mobilized from the subcutaneous, and that will enhance the detox. So my view is we all need to do that. And then heavy metals, again, don't spend money on the tests, just do the heavy metal chelation. And we talked about MSM earlier. And as we speak, I'm doing a study looking at levels of heavy metals in urine using MSM. And it's very clear it's a very useful chelating agent. Now, it doesn't do all the heavy metals. It's not brilliant for lead and mercury, but it does pull some out. What it is brilliant for, and I'm so excited about this, it's brilliant for aluminium. I see very high levels of aluminium come out. And you may be aware of the work of Dr. Chris Exley, who's based up in the northeast here. His nickname is Mr. Aluminium. There's nothing he doesn't know about aluminium. And he maintains that we are all poisoned by aluminium. And of course, aluminium, is the main adjuvant that's used in immunizations. He maintains that the only way you can get rid of it is with silica water, which, yes, that may well be right, but it's very expensive. And, my patients can't afford to drink silica water every day, but they can afford MSM. Again, I had another patient who did this who spiked very high levels of bismuth, which is a nasty toxic heavy metal. So I said, Frank, how on earth where did that come from? Oh, he said, about 20 years ago, he used a preparation called Denol or Pepto-Bismol to treat stomach ulcers. It might be effective, but in taking that, you're going to poison yourself with bismuth. So again, MSM will pull out the bismuth. And recently, of course, one of the favorite radio contrast dyes used is gadolinium, which is a very toxic heavy metal. It's often used to diagnose myocarditis or as an enhancement for MRI scans, but MSM pulls that out beautifully well. So anybody who needs such a scan should take MSM before, during and after to make sure the gadolinium does its job for the purpose of the scan and is then pulled out of the body. So MSM is going to be a very useful tool. And when I've gathered sufficient data, we can then publish to see exactly which metals are pulled out most effectively. DMSA is very good for lead and mercury. So I think I shall probably end up with a hybrid regime of DMSA, 50 milligrams per kilogram of body weight taken every week, once a week for maybe 3 months. And then MSM, 10 grams a day, every day for say 3 months. And that will do a pretty good job for the majority of people to strip out their heavy metals. Now, one word warning about MSM. It is so effective that you can get quite severe detox reactions with it. So always start with a tiny dose. Always start with just 1/4 teaspoon a day and then build up slowly to 3 teaspoons a day. Do that for 3 months and then maybe in the longer term, a maintenance dose of 1/2 teaspoon a day. So that's going to tackle the insulin resistance side of things. And with all that in place, that's going to go a long way. But having done all that, it's always lovely to test to make sure that you have arrived. And probably the easiest test for people to do is 2 weeks of continuous glucose monitoring. You can buy the kits on Amazon. I use the Abbott Freestyle Libra, and they give you they're painless to use. Read the result on a smartphone, and that will tell you exactly what's happening over 2 weeks. And it tells us 2 very useful things. The first thing is we are all a little bit different. Some people get away with some foods, but not others. And if you are allergic to a food, interestingly, that can manifest with a blood sugar spike. So I had one person who got massive blood sugar spikes, when they had their allergic food, but not because it was a high carbohydrate food, but just because they were getting an allergic reaction to it, probably mediated by stress hormones. And the other thing that's useful is if you do spike your blood sugar, you can then see how long it takes to come back down again. So now it just so happened I did a riding holiday in Sicily a couple of years ago, very dear friend of mine, and she had a continuous glucose monitor. So I thought, this is going to be interesting. So we were pretty well behaved, for the first few days, but having a glass of wine, no problem. It stayed very strictly between 4 and 6. Now, riding holidays in Sicily, 8 hours on a horse every day, in the middle of nowhere for lunch. What was the typical Sicilian picnic? A large hunk of bread and a little bit of salami. So of course I fed the bread to the horse and ate the salami, but Charlotte, she ate the bread. And she's not diabetic. Her blood sugar shot up to 11. I have to. I was blown away by that, and that's just from white bread, which maybe there's some sugar in it, but it illustrates how rapidly starches can be broken down to sugars. But the good thing is, her blood sugar fell immediately after, and therefore she didn't have insulin resistance. Her insulin obviously spiked, brought the blood sugar down very quickly, and all was well. But if you had insulin resistance, then the blood sugar would spike up and it would stay high and it would take a long time to come back down again. So that's a very good clue. We can all do this at home and diagnose insulin resistance and which foods are definitely safe to eat. But do put all these interventions in place first. Because if I know what the result's going to be. If someone's eating high carbohydrate diet, their sugar's going to be all over the place. But do all these interventions first, and then continuous glucose monitor, and that will tell you if you've arrived.
When it comes to testing, this is something I wanted to get into. You mentioned the CGM and then looking at the spike and how quickly it comes down. That's a great tip. How do you feel about fasting insulin, or something like a Kraft test where you're actually pushing glucose in the body and then over a period of time seeing the reaction?
Well, those are also very useful tests. And fasting insulin should be very low. And in fact, an insulin tolerance test is probably a better test than the glucose tolerance test. But it's not done in this country, and measuring insulin is expensive. So we can infer what insulin is doing by measuring sugar, which is very cheap. One little tip, just to which can confuse the results, is that vitamin C is a very similar molecule to sugar. In fact, animals can make it's only humans, fruit bats, and guinea pigs that can't make their own vitamin C. But all other animals can make their own vitamin C from sugar. It illustrates the point they're very similar molecules. And if you are taking high dose of vitamin C, and the test that you're using involves glucose oxidase, then you might get a higher result than expected. In fact, I shocked myself one day because I just tested my glucose out, and it was 7. I was absolutely horrified, but I just mega dosed with vitamin C because I'd had a bit of a cold. So the vitamin C will increase, it will give you a false high of glucose. So just bear that in mind if you're using the glucose oxidase strips for testing blood sugar.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
For insulin to work, it's got to have some essential cofactors. Things like chromium, carnitine, vitamin B3 and vitamin B1. We can have insulin resistance because the insulin receptor is blocked